Hello, everyone, and welcome. It's truly a pleasure to have you all join us today as we celebrate International Women's Day with a focus on something incredibly important our oral health. Today, more than ever before, it is possible to maintain our teeth for life. Not too long ago, losing teeth was something people simply expected with age. But with the right knowledge and care, we now know that a healthy, complete smile can stay with us for a lifetime. But let's not forget, oral health is so much more than just teeth. It shapes our very being. The warm smile we share with a loved one, the conversation that connects us, the meals we enjoy with family and friends, even the very structure of our face that defines who we are. Oral health is deeply intertwined with our identity, confidence, and well being. That's exactly why we are here today to discuss how we as women can take control of our oral health at every stage of life. This event, A Lifetime of Smiles, Empowering Women's Oral Health from Infancy to Golden Years, is an initiative by Oral Health 360 in partnership with PFA India and POPMA. Together, we are committed to making oral health education accessible to all. We have an incredible lineup of speakers who will share their expertise, and we look forward to engaging discussions. Now, to start things off, I would like to hand over to Dr. Maya Ramesh, Secretary of Pierre Fauchard Academy India section, to share a few words about PFA India's commitment to public education and start the ball rolling. Of course, give me a moment to bring everyone in. Yes, here we are.
Very good evening to all the bold and beautiful ladies gathered here. Happy Women's Day to you all. The Pierre Fauchard Academy is a service organization of dentists started in United States of America in 1936, and we started it in India in 1976. From 1986 onwards, we became active. The golden rule of PFA is placing the welfare of patients above the personal aims and desires. We focus on giving awareness camps and treatment for oral health improvements to the general public. We are also awarding fellowships to the dentists and awards for students for their contributions to the society. Taking care of yourself means prioritizing your health, and oral health should never be neglected. The oral cavity is the mirror of your health. Prevention of diseases should always be considered as priority, along with early detection and treatment. On this special day, I encourage each one of you to prioritize oral health, which can boost your confidence, not only for today, but every day. Ladies, let's look after our smiles, our health, and our future. Here is to healthier smiles and healthier lives. Cheers and Jai Hind. I welcome you all. And let me introduce the first speaker of today, Dr. Apeksha Anand. She has finished her MDS in pedodontics. She is a strong believer that prevention is better than cure. A message she shares under the popular pseudonym of Dentist Auntie. I welcome you to deliver the guest lecture of oral health from infancy to adolescence. I welcome you.
Hello, happy Women's Day. Welcome to a lifetime of smiles. I'm Dr. Apeksha Anand, and my specialty is pediatric and preventive dentistry. And folks, prevention is the need of the hour. I thank Dr. Mandana and Oral 360 for providing this opportunity to speak to young girls and mums of young girls so that we can prevent oral health problems instead of treating them. I've divided the presentation into three age groups because there is a lot of anticipatory guidance to be given at each stage. So let's start with the newborn and toddler years. Did you know 60% of all Indian children have cavities? That is a huge number, right? Let me start this with a shocker. Each of these children are less than 4 years in age. This is what I see in the clinics every day, and this is what we're trying to avoid in this young age. How do you avoid this? What do we do that we don't end up with children of 2, 3, 4 year olds getting cavities of that extent or even at all? So, before the teeth erupt, it's extremely important to start cleaning the baby's mouth with a cloth, a muslin cloth, or a finger brush. The child should know that you are going to clean the mouth once in the morning and once in the night, that mama is going to do this. What happens when the baby is teething? All hell breaks loose. Of course, it's so much fun. The babies look so cute, but probably the night's sleep is lost. They're crying a lot, they're fussing a lot, they're putting everything in their mouth. There are so many changes that are happening. So, what are the teething signs and symptoms? A lot of people say that when the child is teething, they tend to get a fever. However, the body temperature can only get raised by zero point 0.2 to zero point 0.5 degrees, not more than that. Any more fever is a sign of an infection and has to be treated differently. Of course, there are behavioral changes like we spoke right now. The children are fussing, they're a little bit irritable, they want to put things in their mouth. And because of the gum irritation, they tend to do that. They put things in their mouth, which is why it's a good idea to provide them teethers. Let's talk a little bit about breastfeeding and teething. There is a lot of biting happening at that particular time. The next thing that happens when the baby is teething is the latch changes. They are nibbling on the breast many a times and not taking the entire areola the way the mothers have been taught that the child should be feeding. They don't take the entire areola inside the mouth and feed. So it's very important, especially when they are dream feeding or when they are feeding in the night, that the child has a good latch. Now, what happens if the latch is not good? The milk pools in the front part of the mouth instead of dribbling into the throat. It pools in the front of the mouth, and if you are not brushing properly, if the child is not allowing you to brush properly, there is a lot of plaque on the teeth. And if there is plaque on the teeth and there is milk surrounding that plaque, the bacteria in the plaque are going to ferment that milk and cause acid. They create acid, and if there is acid surrounding the teeth are going to get decayed. So, how do we make it easier for a baby that they don't feel uncomfortable during teething? The most important thing is massaging. All right, with a clean finger, you massage the gums, and they can self-soothe by holding a teether, biting on teethers. These are all different kind of teethers. If they're feeling discomfort at the back of their mouth, a long teether helps. If it's in the front of their mouth, a short teether helps. How do we alleviate the pain that the young children are feeling? There are various methods. Allopathic medicines are available, which is painkillers. Homeopathic medicines are very, very, very common and popular. Uh, Ayurvedic medicines, there are certain flowers that Ayurveda suggests help in alleviating discomfort of the tummy, of the nerves when the child is teething. And of course, every house has their own home remedies. Teething foods to alleviate discomfort of the gums, like hard breads, teething biscuits, and breast milk lollies, which are quite popular nowadays, are a good idea. Now, extremely important, from the first moment that the teeth have erupted in the mouth, it is important to start brushing the child's teeth. Whether you use a toothpaste or not is besides the point. But the mechanical motion of brushing your child's teeth is extremely important. Now, please take note of these pictures. All of these pictures are pictures of teethers. They are not toothbrushes. What do we look for in a toothbrush that we want to use for our child? It should have a small head and it should have extra soft bristles. This is in the beginning when the child's teeth have just come out. Within 6 months, we have to change the type of toothbrush. Also, what kind of toothpaste? Very commonly, I'm asked, what kind of toothpaste should we be using? Most parents go for non fluoridated toothpaste. But in a country where 60% of children are getting cavities, it's very important to use fluoridated toothpaste. India is not a fluoridated country. There are few pockets of areas where the fluoridation in the water is very high. But say a city like Bombay or Delhi, there is no fluoride in the water. So it's very important for us to use fluoridated toothpaste. And we're looking for a toothpaste that has 1100 to 1500 ppm of fluoride. Also, it is important to note that you cannot use this toothpaste, like you use regular toothpaste. You have to use it at this young age. You have to use it in a rice grain amount. That is all. So up to 2 years, you use as much as a rice grain, and after 2 years, you use it as much as a pea size. It's very important that you're able to see the child's teeth when you are brushing. Please consider that if you have not been able to observe yourself brushing your child's teeth, then you have not done it properly. So it's extremely important that you do, stabilize the child when you are brushing their teeth. Make them lie down, or you can sit with another person, sit knee to knee with another person, and put the child in between the two of you all, and then brush the teeth. Or you put the child's head in your lap. But it's always, always, always important that you lift the child's lips and cheeks to see the teeth when you are brushing the teeth. If you can see, that means you have done a good job. What's happening around 6 months of age? The child is teething, they are fussing. The pediatrician is probably telling you that they are, the weight is enough or not enough. And if the weight is not enough, then you need to make them eat more. The children have already started on solids. So when you want to make them eat more, you're going to add sugar to the food. And if the child says, no, I won't brush my teeth, the germs are going to eat the teeth up. That's as simple as it is. A lot of parents feel that if they add jaggery or honey to the food is more nutritious. Yes, jaggery does have a little bit more iron. However, it is still sugar. Jaggery and honey are both around 80% sugar, and maple syrup is about 70% sugar. And sugar is a major cause for cavities because sugar is sticky, it gets stuck on the teeth, and is an easy source of food for the bacteria which are living in the plaque. Now let's start with the middle childhood years. The teeth are changing in the middle childhood years. From 6 years to about 13 years of age, the milk teeth are falling and the permanent teeth are coming into the mouth. What we look at these ages are habits like thumb and digit sucking. What happens when the habit of thumb sucking continues? There are consequences that are there. The palate becomes V-shaped and thinner, the palate becomes higher, there is crowding in the front teeth. Mouth breathing. This is a habit that the children develop because they are not able to nasally breathe. It's very important for us to understand that the nose is a filter of the body. If the air that we're taking in is not cleaned by the nose, then we're creating more problems for the body. Also, breathing through the mouth creates other issues like the growth of the face changes. Let's have a look at the next slide. Now we have two girls here, one in blue and one in red. The girl who is in blue was breathing nasally as she was growing, in her growing years, the middle childhood and prepubescent years, and therefore her face profile is normal looking. The girl in red was breathing through her mouth in the prepubescent and early childhood years, which is why her midface has increased in size. She has a small lower jaw. This is what we call bird faces. This is what happens and is a negative consequence of breathing through the mouth. So it's important for us to break habits in the middle childhood years. Now let's get to the adolescent years. The most important thing that we're looking at in the adolescent years is the high incidence of gum diseases and cavities. And that is all because of hygiene. Why does this happen? The causes are braces, hormones, genetics, and late night studying and snacks. Late at night, there is not enough saliva in our mouth, and the snacks that we eat probably don't help the plaque any further. With this, I would like to say the takeaway points from this presentation are brush your teeth well and eat better. Thank you.
Yes, hello, we are back. Dr. Maya, you can take over.
Yeah, it was a wonderful presentation. Let me introduce the second speaker now, Dr. Sonal Tambekar. She's a Mumbai based periodontologist, implantologist, and academician, and she's involved in an NGO dedicated to the upliftment of women. And let me welcome her, and she will be giving a lecture on navigating the oral health during adult life, early adulthood, pregnancy, and menopause. I welcome you, ma'am.
My viewers, welcome to the show. Thank you, Dr. Mandana, for letting me talk over here. Today, I'm going to talk about the changes that we encounter during our adult life and the manifestations of which are seen in the mouth. So, let's just begin. What is gum disease? Like any other infection, gum disease is caused by a pathogen or a germ which attacks the gums, leading to gum disease. What happens to the gums? The gums are red, swollen, there's bleeding spontaneously or while brushing, there's bad breath, and also a foul taste in the mouth. Imagine a war. We have a huge army of ourselves and are being attacked by the enemy. The number of soldiers in the enemy is constant. Our soldiers are also constant, but depending upon the weapons that we possess, we can either win or lose this war. A similar situation is going on our gum boundary. The number of bacteria that are attacking is the same, but how the gum responds to this bacteria changes. The hormones are handing out the weapons to our little soldiers at the gum level. So, what are these hormones? Hormones are substances released by the glands or the body called endocrine glands. These hormones are pretty much responsible for the overall regulation of the body. Today, we are going to talk mainly about two hormones, estrogen and progesterone. The biggest fluctuations in this levels of estrogen, progesterone, and to some amount testosterone also happens during puberty, pregnancy, and menopause. Puberty for the girl child is between 11 and 14 years of age. However, early puberty of kids as young as 8 is also documented. During puberty, the estrogen levels increase and the gums react far more aggressively to any bacterial onslaught. This is further compounded by decreased parental supervision. Children don't like parents telling them to brush their teeth in the night, brush their teeth in the morning, sometimes late nights, junk food, midnight snacks. All this is a perfect picture for the bacteria to get harbored out of the gums. Sometimes you might have experienced some tightness in the teeth and gums and occasional bleeding just before or during your menses. But this is completely and totally temporary. Next, we come to pregnancy. In pregnancy, you might see swollen, red, and bleeding gums, especially in the second and the third trimesters of pregnancy. During pregnancy, antibiotics should be avoided. So, it's very important that a good oral hygiene is maintained from the first trimester itself. Uh, Also, good nutrition and supplements are required during pregnancy. Untreated gum diseases during pregnancy may contribute to premature birth and low birth weight. Sometimes a little swelling between the two teeth at the gums called a pregnancy epulis also forms. After the baby is born, this swelling normally regresses. Excision of this epulis is not recommended during the pregnancy time mainly because it might cause bleeding and we don't want to give antibiotics again. However, if the swelling is very big, it can be excised. No, the baby is not going to take all the mother's calcium, causing her teeth to fall. In fact, if there's a nutritional deficiency, the baby is going to be impacted much more than the mother. Cleft lip, cleft palate are seen much more where there is nutritional deficiencies in the mother during pregnancy. Next, we come to menopause. Menopause is a very difficult phase in a woman's life, not only in the physical sense but also in the emotional and the mental sense. There's a decrease in the levels of estrogen, leading to thinning of the mucosa and the gums. This is further complicated by decrease in the saliva. Saliva is very essential because the continuous flow of saliva flushes the entire mouth. Apart from that, saliva contains enzymes and antibodies to heal and protect the gums and mucosa. You must have seen animals lick their wounds to heal them. And overall, there's a decrease in the calcium also. There's osteoporosis all over the body. Similarly, there's osteoporosis also in the bone surrounding the tooth. Menopausal women are recommended to do weight bearing exercises. Unfortunately, here we can't do any weight bearing exercises. However, what we can do is we can have excellent oral hygiene by regular brushing. I recommend water flossing twice a day, visit to the dentist regularly for cleaning, replace all the missing teeth. When you don't have teeth, your nutritional suffers. You will not have high fiber diet. You will avoid salads, fruits, vegetables, going towards a more high carbohydrate diet, and you'll have nutritional deficiencies, gas, bloating, acidity, and lots of complications. So replacement of missing teeth is equally important. So, whatever phase in life we might be, whatever might be a situation, when there is a woman, there is a way.
Thank you for an informative lecture, Dr. Sonal. And I have a query. How do you advise brushing? How many times a day would a normal person brush? And is there any a pregnant woman should brush more or something like that?
Uh, so, uh, uh, like we've always been taught, is my voice echoing?
It's okay, Sonal.
Is that better? Okay.
Yeah.
Like we've been taught always, twice a day brushing is important. However, I always recommend to brush after breakfast in the morning and just before you sleep in the night. These are the two, it's not how many times you brush, but when you brush also, which is very important. And for pregnant women, yeah, it's not only about brushing, it's about also water flossing, keeping your gargling. All the different adjuncts also are equally important as much as brushing. So if you are eating a very, very high starchy carbohydrate rich diet, then yeah, you're having a caramelized chocolate, you need to brush after that, especially for pregnant women. And otherwise also for, regularly for everyone.
Do you advise a mouthwash for any normal person or?
So I don't think so. Mouthwash is really required for a normal person. It's just a feel-good factor. Uh, a brushing and flossing is more important.
And I have a question about my daughter who is there in Kerala. She's 23-year-old and she has gingivitis, and I cannot find plaque at all in her mouth. And she keeps complaining about bleeding gums. What can be
She's
the
20.
cause?
Does she have mouth bleeding?
23 years.
Does
Yeah,
she have
that I
incompleted
haven't.
lips?
No.
This is one of the reasons mouth breathing also can cause gingivitis, especially in the anterior
Okay.
region. Okay, is the gingivitis
Okay.
all the time or is it during only certain periods?
She's having gingivitis all the time. She keeps on telling about bleeding gums, and she keeps going to dentists, and scaling will be done always. But again, that complaint persists.
When has she last got a scaling done?
Maybe 1 month before.
Sorry,
1 month before.
1 month before, and still the gingivitis has not decreased in spite
Yes.
of the scaling.
Yes.
So you must check. I
They are
think it's more of
advising
a
deep scaling.
It could be because of an ortho problem also, because of mouth breathing also. Probably she has some occlusion problems. That's the reason also she could have gingivitis. It's not only because
Okay.
of plaque.
Okay.
Like I said in the presentation, it's not about the plaque doesn't, in any of these situations, plaque will not cause gingivitis. It's the response of the body that causes gingivitis when you have a hormonal change.
O- Okay. Thank you very much, Dr. Sonal.
Thank you for having me over here.
Thank you. Now, let me welcome the third speaker of the day, Dr. Supriya Kher. She's an oral pathologist, academician, and researcher dedicated to improving oral cancer outcomes. And she'll be delivering a lecture on oral cancer in women, the risks and prevention. I welcome you, Dr. Supriya.
Greetings, everyone. It is truly a pleasure to be here with all of you today as we celebrate the strength, resilience, and health of women on this special occasion of Women's Day. My name is Dr. Supriya Kheor, and I am a dentist, practicing dentist, and an academician. Over the years, I have had the privilege of working closely with women's oral health, especially in the areas of cancer detection, prevention, and awareness. As a part of my work, I have seen firsthand the impact that early detection and prevention can have, and I am passionate about sharing this knowledge to help empower women in protecting their health. Oral cancer is a growing health concern worldwide, and its prevalence is particularly alarming in our country. In our country, oral cancer is the third most common cancer, and widespread use of tobacco in various forms combined with lack of awareness has resulted in an alarming rise in oral cancer cases, especially amongst youngsters and women. Yes, in recent years, the number of women diagnosed with oral cancer has been increasing. Several factors contribute to this rise in incidence, like advanced age, increase in trends of tobacco and alcohol consumption, increase in weight, sometimes genetic factors and environmental toxins also play a role, sunlight and radiation exposure, and now we have viruses like human papilloma virus at the forefront for developing oral cancer. Women are increasingly becoming more susceptible to oral cancer due to an increased consumption of tobacco products, smokeless tobacco products like Misheri, especially in rural areas of our country. There has been an increase in trends of tobacco consumption among pregnant women where tobacco application initially decreases the morning sickness. Another report says that smoking has increased up to two folds among teen girls from 2012 to 2024. Other than these faulty eating habits resulting in poor nutrition and on a backdrop of hormonal imbalances around menopause could also set the stage for oral cancer initiation amongst women. But what is even more alarming is the trend of developing oral cancer in women patients who do not smoke or consume tobacco. So, we as women have been hit from both the sides because of an increase in tobacco consumption and alcohol consumption, and also specifically in cases where there has been no history of substance abuse, but other factors have led to formation of oral cancer. Let us see few cases. This is a 60-year-old lady who came with the main complaint of an ulcer on the side of the tongue which has not healed since a month. This is another patient which came with pain and persistent bleeding from the tongue at the back of mouth near third molar area. Another patient came with a growth on the palate which resembled initially like an infection, which we thought to be probably to be because of decay in the teeth and pus. There was another patient with a case of small cut and ulcer at the corner of the mouth, which initially resembled blisters due to viral infections. But all of these on histopathology turned out to be oral cancer. So, ladies, we are different because we can have oral cancer presentation even without the use of tobacco and or alcohol. These types of presentation are mostly seen on the tongue, wherein an ulcer which has not healed for more than 15 days or it is still constantly poking may not be very painful, could be one of the symptoms. Hard palate and upper jaw are more commonly involved, in contrast to men, where the cheek mucosa or the lower jaw is more commonly involved. Then, and another report which says that biological influences like endocrine factors influence oral cancer. There are studies which prove that elevated fasting glucose level can also be a trigger factor for developing oral cancer amongst women with estrogen deficiency. So, all this goes to prove why elderly females with an increased predisposition to oral cancer, even if they do not have any deleterious habits. What has been another concern is that in these patients we can have sharp teeth, which due to attrition or faulty dental restoration or partial denture clasps. All these causes constant irritation, which changes the oral tissue over a period of time, increasing the cancer risk. A note of caution: in women with history of breast cancer, any non-healing ulcer has to be looked upon with suspicion, because sometimes we would have breast cancer which was treated 10 years back, but the patient presents with a small ulcer on the tongue, and on biopsy it does show oral cancers. But due to an increased smoking habit and changed tobacco consumption pattern, the age gap has been reduced, with increasingly younger women succumbing to oral cancer. Research shows that females have a shorter duration of smoking than males, time wise, before the presentation of oral cancer happens. Going forward, let us look at the common signs and symptoms of oral cancer. In most of the cases, it is a persistent ulcer for more than 3 weeks in the oral cavity. It could be a red or white patch in the oral cavity, a lump or a growth in the mouth, a feeling that something has got stuck in the throat, thereby causing difficulty in chewing and swallowing, or a change in voice. Sometimes it could be unexplained bleeding in the mouth or mobility of teeth, and swelling in the neck which does not get resolved with conservative treatment. Luckily for us, before actually cancer strikes us, there are something known as pre-cancer or oral potentially malignant lesions. You can see a white patch, a red area in the oral cavity. All of these, or a growth, all of these are signs that tell you that you need to go and show to your dentist or a specialist and get it sorted. So we have now seen that what could be the presenting signs and symptoms in the oral cavity. Thereby comes the critical role of prevention. Why taking early action is essential, because the earlier we catch oral cancer, that much more are the improved survival rates. Impact on community health is tremendous when the lady of the house gets involved or gets oral cancer. Importance of awareness is there so that the rest of the family members or people around you in the community could also be made aware of the ill effects of tobacco and alcohol, and the advantages of showing going to a dentist or specialist in case of any of these lesions, thereby empowering females. How we are taught about breast self examination for breast cancer, like that oral cancer screening can be done at home and quite regularly. This would empower us to catch these lesions early and consult our dentist or specialist for the same. There are many steps in oral cancer screening. First is to check your face and neck. So we can check our neck and face for any swelling or bump or growth or discontinuity. This can be done by just palpating or feeling our right side of the neck, our left side of the neck, and just below the chin. Then we can check our lips by pulling and lifting our upper lip and our lower lip, and then pull and stretch our right and left cheeks. Then we should also check our gums, especially for any form of resistance, any white or red patch, any growth, and any ulcer, pain, or bleeding. Then we need to check our tongue. This can be done by raising the tongue so that the lower portion of the tongue is visible, moving the tongue on the right and the left side to check the side of the tongue where it comes in contact with the teeth for any deformity or abnormality. Then we need to check the roof of the mouth, that is your palate, and floor of the mouth, that is the portion below the tongue, for any changes, any red or white patch, any growth or abnormality. So we just saw how we can do oral self examination. So till now we are looking at how to detect oral cancer at the earliest, so we are able to tackle it. Now let us come to the strategies for prevention of oral cancer, that we do not end up suffering from oral cancer. First and foremost is quitting all forms of substance abuse, that is tobacco, smoking, smokeless forms, as well as alcohol intake. And what we need to do is go for regular dental checkup. Your dentist is the first person to alert you if there are any changes that are occurring in the oral cavity. From your side, you can have an extremely healthy diet full of micro and macronutrients which would boost your immunity, so you're able to ward off infections and malignancies at the earliest. And most important is maintaining a good oral hygiene. Like we mentioned that viruses like HPV are responsible for developing oral cancer, so are various bacteria which are residing in your gums. So if your gum health is not good, if there are infections in your oral cavity, if there is bad odor, if there is bleeding from from the gums while brushing, all these shows poor oral hygiene. So if we can have good oral hygiene maintenance, we would be beating oral cancer before long. Key takeaways from this presentation are: A. Knowing the risk of factors aids in early detection of oral cancer and thereby improves outcome. So, understand the risk factors and stay away from tobacco and alcohol. Early detection significantly increases the chances of successful treatment. Third is adopting healthy habits, which can lower the risk of developing oral cancer. Fourth is regular checkups with dentists, which are crucial for monitoring your health. And the last and the most important thing is educating oneself and others, thereby empowering everyone, which helps in reducing the stigma associated with oral cancer. So, working together, we can reduce the incidence of oral cancer. The collective efforts from all of us would play a major role. At this time, I would like to thank Oral Pathology 360 and Dr. Mandana for taking up this initiative and getting the message across that oral cancer is preventable, and empowering ourselves with the exact cause, the detection, and prevention strategies. We could go a long way in reducing the cancer incidence, especially in women. Lastly, I would like to say join our mission to empower women in taking control of their health and spreading awareness on oral cancer prevention. Together, we can create lasting change. Thank you.
Thank you, Dr. Supriya. It was a very informative lecture. I don't think that there will be any questions for anybody. You have covered everything from the oral cavity examination, self examination, the precancerous lesions, the causes of cancer, how you can prevent it. You are spot on. But anyway, I just want to ask one question. We are seeing so many cases in very young women also in our college, oral cancers. And I think that if it is posterior, some people say that if it is posterior part of the oral cavity, it may be papilloma virus involvement more. What do you think about, what's your opinion and what's your experience regarding that?
Thank you, ma'am. Yes, I do think if it is the posterior part of the oral cavity, then it is human papilloma virus, mostly probably from their male counterparts that they are getting. So this is also a thing that we need to look upon, but it is not so much predominant in our society. It is just coming up now. More importantly is reduction in tobacco and alcohol consumption, no sharp tooth or irritation, chronic irritation that should be taken care of. But when you talk about posterior part of the oral cavity, it is generally infections, because still that area there is no irritation as such, or even the tobacco and alcohol consumption does not affect that area more. So if it is posterior area, then it is infection. So maintaining oral hygiene, regular frequent checkups would go a long way in solving this problem.
And do you advise this papilloma vaccine to men also? Any idea regarding that?
Ma'am, it is being advised very staunchly from most of these developing countries and all. They are saying that HPV vaccine should be given to men. We are taking it because for cervical cancer, females are taking it, but men should also be given so that would prevent further progression to oral cancer. I am personally not having so much of knowledge whether it would actually cause, but theoretically, if you go to see, yes, giving vaccination to males should reduce the cancer incidence in females.
Thank you very much, Dr. Supriya.
I think, sorry to interrupt, but I think basically vaccinating the males will also break the chain. It helps in breaking the chain of infection. So that is another thing. Dr. Maya, we have a question which was from before, and let's see if Dr. Apeksha can speak now or rather be heard. Uh, I will bring that question here so that she can answer. Right.
Any advice on black stains on teenage anterior teeth? It's for Dr. Apeksha.
Can I be heard?
Yes.
Yeah.
Yes.
Is there anyone able? All right. So, yeah, there are few things to consider where teenagers are concerned and when there are anterior stains. One is poor brushing. If they are not brushing well, then food stains. Indian food has a lot of color. So, there are a lot of stains that get left on the teeth. So, consider telling her to brush better. And the second is something that is not really in our hands. It's called chromogenic bacteria. They create stains on the teeth. So if she has really clean teeth and still there are stains, there's a complete chance that she has something called chromogenic bacteria in her mouth. They create a stain, and there's not much we can do about it except regular cleaning, but it comes back. Uh, it does stop on its own after a certain age, say about 18 years or so. After that, it stops completely. The bacteria just get eradicated from the mouth. After that, the children don't have any issues.
Okay. Thank you. And regarding that earlier question, when do we start the
Yeah.
brushing? Before the teeth erupts, should the mouth
Before
of the
the
child?
teeth, yeah, before the teeth erupt, we have to clean the mouth with a muslin cloth and make sure that the child knows that the mouth is going to be cleaned twice a day. So there are two reasons that we do this. One is that the child gets used to it, and the second is that the parent gets used to it. Because the parents are so scared of putting their hands inside the children's mouth and brushing, that they really need to get used to the fact that the hand can be put inside without causing gag to the child. So it's very important that both the child and the parent get used to putting the hands in the mouth.
Yeah. Thank you. And I have one more question. Regarding the fluoride toothpaste, you were telling that it should be given to the children. From what
Yes.
age you will be suggesting fluoride
From
toothpaste for the
day one,
kids?
from day one, it can be given to the children. All right. First, it has to be used in a rice grain amount till the child is 2 years of age. Just a small smidge on the toothpaste, on the toothbrush. And after that, it can be used in a pea-sized amount. It's a medicated toothpaste. We have to remember that. We cannot
But this
give the child the toothpaste and say, eat it.
yeah, pediatric toothpastes are made very tasty. So
Yes,
will that
there
end up
are
in
fluoridated.
kids eating it?
Yes. Yes, which is why the toothpaste has to be kept far away from the reach
Yes.
of the child, and we have to apply it just a bit on the toothbrush. Then they
Yes.
can eat it up.
Parents should keep it
The
away.
reason
Yeah.
that we are asking for such a less amount of toothpaste on the toothbrush is because the children eat it. Any which ways they cannot spit till they are 3.5 years of age. So if they cannot spit, they are going to swallow it.
Thank you. Thank you very much, Dr. Apeksha.
Interesting.
Thank you.
Yes.
And let me
We have
welcome.
one more. Sorry, we have one more question. Should we take it now or should we do it afterwards?
Take now.
Okay, this one is, I guess, for Dr. Supriya. I don't know how you're going to answer this. Okay.
How
How much
much
is
is toothpaste?
toothpaste?
Yeah, responsible for oral cancer.
No, there are certain toothpaste like I'm not naming them, but they contain some amount of tobacco products. It could be lal dant manjan, or there could be some Ayurvedic formulations which we are not very sure, and they have this abrasive particles in it, which is basically for mechanical cleansing. So yes, some amount of it, or it might give you contact stomatitis or some sort of a reaction in the oral cavity, which could further lead to. There is not too much evidence that toothpaste is directly linked to oral cancer, but it could be an attributing factor if it contains tobacco or if it contains particles of tobacco which are coarse, so which can cause some mechanical irritation, plus leave a lot of amount of tobacco on, especially near the gums or in the gingival area, what we call near the gums. So it can contribute to. So it is better to avoid toothpaste where the contents are not very clear or which are Ayurvedic formulation or which are colored. So it is better to have a toothpaste which is white in color and where the contents are very clearly legible on the paste itself.
I have a question now. Is triclosan related to oral cancer? Triclosan contained in oral toothpaste.
There are certain reports that it does. There are reports like that, but it's a very long sort of association. Like it will cause some amount of irritation, or it will cause some reaction there, which might cause epithelial thinning, which would lead to. But otherwise, there is no direct evidence that it is responsible for COVID.
Thank you, Dr. Supriya. Let me hand over my mic to Dr. Ketaki Kelel, Vice President of POPMA. Welcome, Dr. Ketaki.
Yeah, good evening, everyone, respected colleagues, distinguished speakers, and esteemed audience. So, it is a privilege to be here representing POPMA as a vice president of the organization. And POPMA is practicing oral pathologist and microbiologist association. And as oral pathologists, we are more than diagnosticians, is what we believe. We are advocates, educators, innovators, shaping the future of healthcare. So, our impact extends far beyond the microscope. We are actively driving change in patient care, public health, and policy developments. So, at POPMA, we are committing to bridging the gap between pathology and clinical practice, ensuring that every biopsy, every report, and every expert consultation will transform into better patient outcomes. So that is the reason public health remains central to our mission, and women's oral health in particular demands urgent attention. From puberty to pregnancy to menopause, women they face unique oral health challenges, and as we have speakers out here talking about each phase, I think through interdisciplinary collaborations, we will aim to address these concerns with awareness, education, and early diagnostics. So, looking forward for a for a very optimistic approach after this live stream. Also, now I would like to take pleasure to introduce our next speaker for today. Dr. Letzia Lang from Brazil. Dr. Lang has multiple specializations in hospital dentistry and public health and community action, lasers in dentistry, and has been exclusively caring for cancer patients since 2002. Ma'am, that's really amazing to know. And we are all eager to listen to your words of advice. And her topic is oral complications of cancer treatment and their management.
Thank you. I'm very happy to be here. Thank you. Hello, I'm Dr. Letícia Lang. I'm a dentist from Brazil, and I've been caring for oncology patients for almost 30 years now. So today, I'm here to talk about oral health care during cancer treatment and give you some useful tips. To start, please never compare yourself to another cancer patient. Each individual is unique, and there are different types of cancer and treatments, and therefore everything can be different from someone you know who wants when treated. And this goes for side effects too. Not everyone will have the same side effects, so care always must be individualized. Once again, do never compare yourself to another cancer patient, please. The dentist should be part of your oncology team, taking care of you before, during, and after your cancer treatment, regardless of the location and type of cancer. This care is not only to oral cancer patients. Firstly, before starting any type of cancer treatment, whether chemotherapy, radiation therapy, target drugs, immunotherapy, surgery, bone marrow transplantation, or others, look for an oral medicine dentist for a prior consultation. This is very important, even though I know many of you might not have easy access to dentists specialized in cancer patients. That's okay. Before cancer treatment begins, the dentist will prepare your mouth, removing all sources of infection and trauma to avoid complications when you start your cancer protocols. The dentist will also advise you on the best oral hygiene with the most suitable products to your case. Once cancer treatment has started, there will be periods of low immunity. During those periods, you'll be assisted by the dentist if you need it. However, to undergo some types of dental treatment, you have to wait until your blood cell counting has recovered, as some protocols cause a drop in your immunity. During cancer treatment, dentists will prevent and treat acute oral complications resulting from antineoplastic therapies. And after your cancer treatment is finished, the dentist will monitor and treat late oral complications if that is your case. What oral complications are these? I'm going to talk about some complications, but remember, they don't happen to all patients. So always ask your oncology team what is expected for your cancer treatment protocol, okay? A common side effect is salivar changes, so your mouth may feel drier. You need to hydrate yourself correctly, and there are saliva substitutes that can help during this period, bringing relief. In addition to discomfort that cherostomy causes, saliva also decreases in quality, unable to defend you from microorganisms, which can generate opportunistic infections, such as candidiasis, herpes, bacterial infections in the gums, for example. That's why it's so important to practice correct oral hygiene during cancer treatment. There are things you can do to help yourself, which are: try to use an extra soft or ultra soft toothbrush. Use toothpastes with fluoride and without sodium lauryl sulfate. Use dental floss regularly. There are also good products to dry mouth that can be useful, and your dentist will prescribe these oral hygiene products according to your needs. Some cancer protocols can also cause mouth sores, such as mucositis and stomatitis. There are some effective therapies for preventing and treating these injuries, such as photobiomodulation and others. The taste of food may also change, and all of this can make eating difficult. So avoid spicy or hard foods, as they can hurt your mouth. Choose softer drinks, not too dry or not too hot. In patients that undergo head and neck radiation therapy, the absence of saliva can persist, and the patient may develop radiation-related cavities, a rapidly progressing tooth cavity. There is also the risk of osteoradionecrosis and medication-related osteonecrosis of the jaws in some patients, a lack of bone vitality that can cause important complications. That's why it's so important to check with your dentist beforehand. It is important to learn about the side effects and to learn how to identify them if they happen. ask for help, always. There is a lot we can do to prevent and alleviate these complications. And we dentists can be of great help during cancer treatments. The more we fight these side effects, the faster and lighter it will be. You can count on me. I wish you the best.
Very nice.
Yeah, it was really amazing, ma'am. Uh, ma'am, I here want to ask a question. So, does psychology of and the caregiving of the caregivers also affect anything with the cancer patients? I mean, do you also work on that?
Yes, I'd like to, before we go to the questions, if possible, I'd like to share my screen and show you a PDF that I prepared for you. Okay?
Yeah, yeah, certainly, ma'am.
No, thank you. Hmm. Is that okay? Can you see?
Yeah, we can,
Uh,
but I have to.
Okay? Is that okay now?
Mm,
it's in the smaller window though.
it's a smaller window. I have to work on that 1 second.
Okay, thank you. No, because I don't see myself anymore.
Oh, okay. There you go.
Yes?
Yeah.
Okay.
Okay.
I prepared this guide. It's very simple, but just to help you with some informations about prevention, diagnosis, and management of or complications in cancer treatments. Okay. Uh, I always like to say that this is some informations that help professionals and patients to understand the subject, but in no circumstances it replaces a dental consultation. As I said before, it's very important to consultate with a dentist before starting your cancer treatment, okay? Because it's very individualized. All complications happen in some points, but not always with all patients. So ask for your dentist which complications can happen in your case, okay? So these are the most common complications that we can expect. I prefer not to show images, not to show pictures, because it's not so beautiful. It's ugly, and maybe you won't have it. So you don't have to worry about it, seeing pictures that can scare you, okay? So I will explain you, but I won't show you this now. Maybe you can develop gerostomia. That is the feeling of dry mouth because the saliva will change during cancer treatment. And then we can decrease the quantity of saliva and also the quality of saliva because the cancer treatment, and it provides oral infections, and they must be bigger at some point. It can be fungal, candidiasis, bacterial, like in your gums, infection or inflammation, or even reactivating of herpes. Herpes. Someone has herpes. Okay. We also can develop mucositis and stomatitis that are some painful sores that can affect mouth and throat, and it cause pain and make the food very difficult to eat. Okay, and we also can have taste alterations. Food may taste different during the treatment. And all of this together, you can be without saliva, you can be with some mouth sores and the taste may sound different, and all of this together can make eating very difficult. So that's so important to ask for help, okay? And all these infections that can happen in your mouth may be identified, diagnosed, and treated very soon because your immunity can be low. So we have to treat this during cancer treatment. Uh, when some kind of treatments occur, like head and neck radiation therapy, there are also another kind of complications, like radiation carries is a very rapid progressing cavities that can occur during this process and maybe after also the radiation therapy. It is very different because you won't feel pain with this kind of cavities. So it's difficult to identify. That's so important to be with your dentist after you finish your head and neck radiation therapy. Okay? Maybe it can affect your opening of the mouth. So it's also important to identify it. You can have some pain, not specific pain like neuralgia. You can have some radiation burns in the skin, and there are some complications with bone also that we can hope in some treatments. I always like to tell this. It is very important. These changes don't occur in all treatments. So it's very important to know what can happen in your case. Okay, let me show you. Okay, so how to prevent this? One thing that is very important is oral hygiene. Okay, so you must brush teeth and tongue, the upside of your tongue 3 times a day, and it's important to use an ultra soft toothbrush because your mouth will be very sensitive, and so it's important to be very soft. The toothbrush must be very soft, okay? Gentle movements, so take your time, make it very slowly so that you can avoid gum trauma. It's important to use dental floss, but always ask, just check for restrictions or some alternatives if you can't use it. Mouthwash should be prescribed because there are a lot of types of mouthwashes, and some you cannot use it. You cannot use during cancer treatment because they have alcohol, so they must be avoided. Oral lubricants, it's very important too. And there are many kinds of oral lubricants that you can put in your mouth to make it softer and to fight the dry mouth. There are a lot of products very specific to it. Uh, Other important informations is please stay hydrated and don't drink very acidic or hot foods and dry foods. Okay, don't smoke, please don't consume alcohol. We talk about smoking not only tobacco but also electronic devices, vapes. We unfortunately have cases of cancer, mouth cancer, with some very young patients that use vapes. Okay, this must be avoided, please. And this is important. In some moments, your immunity can have this kind of dropping. and it's normal because of the cancer treatment. It will drop and then it will always be um, going up again, but sometimes your immunity can be very low. And so please don't go to the dentist at any time. There are some specific days you can go to the dentist, okay? And do not go do not undergo invasive procedures like extractions, root canals, gun surgeries, or even cleaning, scaling procedures during cancer treatment without consulting your oncology team, your oncology dentist, and talk to your doctor, okay? Because there are some periods you cannot do it, and there are periods you can do it. So you must know which periods are these. And take care of your prosthesis during cancer treatment is very important because your mouth will be very sensitive and it can hurt. Avoid hard and spicy foods, and we must avoid sugar at some point, okay? Reduce the consumption of sugar. It's not something that you can not have in any concentration, but you have to diminish, reduce. Fluoride toothpaste is very important. Fluoride toothpaste will protect us against this kind of very rapidly cavities. And our saliva is not working very well during cancer treatment. So fluoride toothpaste is very important. Okay? And it's very important to follow dentistry program during cancer treatment so that they can identify all the problems and help you with that. Here, I put some toothpastes without this composition, sodium lauryl sulfate, because this can make your mouth very sensitive and can hurt during cancer treatment. So just avoid this composition, okay? You have to buy some toothpaste with fluoride, but try to use one without sodium lauryl sulfate. And there are a lot of options that you can have. And some products still fight dry mouth. That is very good. Like this one, Shadow Laser, Keen. It's they just fight dry mouth. And also, it's very important to talk about lasers and LEDs during cancer treatment because these devices and these therapies, photobiomodulation, that's a therapy with low power, low level laser therapy, and it helps with mucositis to prevent and to treat these big sores, these big lesions in your mouth. So it's very important to look for it, and some other laser treatments like antimicrobial photodynamic therapy are local treatments that can help a lot with this kind of pain reduction and accelerating healing and also controlling local infection, okay? And so this brings a lot of quality of life because relieves this kind of symptoms. So the importance of these phototherapies, lasers, is very, very high to fight all this kind of complications. We can do it. We can use this low-level laser therapy as photobiomodulation and photodynamic therapy. Okay, here there is a video that I made to cancer patients to help them to understand how these phototherapies can help us during cancer treatment. And so, just to finish, how can we help you? How can a dentist help you during cancer treatment? In fact, we will help before, during, and after your cancer treatment. Before, we'll prepare the patient mouth, removing all sources of trauma and infection before you start your cancer treatment. And also we will educate the cancer patient about this complication, explain them all about these complications, and individualize these complications according to his cancer protocol. Okay? During cancer treatment, we'll manage pain, we'll prevent and treat these oral complications I taught to you, and we ensure a better quality of life because of it. And after the patient ends the cancer treatment, we'll continue doing this kind of preventing and controlling the late complications that can help with these cancer treatments and some kinds of cancer treatment. Okay, so this is why the dentist is so important. The dentist should be in your cancer team to prevent and manage these oral complications, to improve quality of life, and also to make your treatment easy. Some kind of complications can be very serious, and maybe some patients need to stop cancer treatment because of this complication. So that's why it's so important. Provide specific oral hygiene care with some products that are very specific to your case. Control pain because you can eat better. You can eat without pain if you do this kind of treatments, okay? And also control infections. Infections are very dangerous during cancer treatment. And also we work with other cancer team, with all the cancer team, with doctors, nutritionists, and oral health care professionals. So I hope you have a better time during cancer treatment with the help of your dentist. And we are here to help you. And we women must put ourselves together so that we can help each other and make it better. I hope you have a better cancer treatment with our help. And I'm here to help you if you need it. Okay? Thank you very much.
Well, thank you, ma'am, for such a comprehensive and detailed discussion about cancer care. It gives me immense pleasure to introduce our next speaker, Dr. Sunandha S. Ma'am. She is a prosthodontist actively involved in clinically restoring smiles and replacing missing teeth, academician in research and writing. Her topic for today is prosthetic solutions and restoring confidence. Welcome, ma'am.
Good evening, dear viewers. I'm happy and honored to address you all today on the special occasion, the International Women's Day, a day dedicated to celebrate the strength, resilience, and the achievements of women worldwide. I would like to, first of all, wish and congratulate Oral Pathology 360 for organizing such a wonderful session on a lifetime of smiles. Now, let's dive into the topic prosthetic solution and restoring confidence, which is deeply connected to the confidence, well being, and self esteem. We all know that the beautiful smile is more than just an aesthetics. It is a reflection of self assurance, health, and happiness. Unfortunately, many women face dental issues due to age, medical condition, due to financial instability, accidents, so which may cause or affect their confidence and the quality of life. But the good news is that today's modern dentistry has tremendous advancement and it offers solution not only for restoring the function but also to rebuild the self-esteem. Many people, especially the women, prioritize other problems and think it's just a one or two teeth missing. Do I really need to replace it? The answer is yes. Leaving a gap in your mouth can lead to a severe long-term oral health problem that can not only affect your teeth but your overall well-being. So what happens if you don't replace a teeth? Every tooth plays an important role in breaking down the food. If a tooth is missing, chewing becomes harder. The complete force is shifted to the other teeth, which eventually make them weaker. This may also lead to poor digestion and nutritional deficiencies over time. When a tooth is lost, the surrounding tooth begin to shift into the empty spaces. Over time, this might lead to misalignment. The shifting of the teeth may lead to gaps between the teeth and which makes easier for the food particles and the bacteria to get trapped between the gaps. This increases the risks of cavity and gum diseases. This may also eventually lead to tooth loss and serious oral health problems. For instance, if you see in this situation, the upper tooth is supraerect or it is overgrown the um, level of the bone, which had created enormous space between the teeth. This might create a severe gum problem, pain to the patient, and eventually the tooth get lost. So losing one tooth might eventually lead to multiple tooth missing also. If a patient continues to eat with such a improper malaligned tooth, the forces is transferred to the bone, which is transferred to the jaw. This abnormal forces might create problems like migraine, headache, neck pains. Many a patient visit neurosurgeons for such kind of pains and come back to the dentist addressing that it's the neurological problem is completely normal. When we analyze, the normal occlusal plane or the bite plane is totally collapsed. So this had led to such kind of abnormal headaches and joint pains in those patients. So we have to correct this abnormality in order to rectify those kinds of migraines or head pains. So this is a typical clinical scenario which indicates a malocclusion. So the teeth not only helps in chewing, but it also helps to pronounce the words clearly. A missing tooth, especially at the front, may cause speech difficulty and may also affect the confidence in conversation and um, prevents from socializing. The health of your jawbone completely relates to the stimulation of your teeth. So when a tooth is lost, the underneath bone begins to shrink and weakens and cause due to lack of use. So over time it may cause face sagging and aged appearance. So this is called as a sad face appearance and eventually it creates uncomfortability and leading to low self-esteem and causes social anxiety for the patient. So now, what is the solution for such kind of problems? There are multiple solutions, fortunately, in the modern dentistry, which offers replacement of the missing tooth. It could be an individual's oral conditions or the priorities or based on the financial status of the patient. So there are usually two options. One is a fixed and the other one is a removable option. So this removable option is used for a multiple missing tooth that restores the function and the aesthetics. So in a given situation where the patient is not ideal to receive a fixed prosthesis or according to the patient's choice, the removable prosthesis is given or the denture is given. But handling and maintaining is the most challenging aspect of a removable dentures. So let's now see how to maintain a removable prosthesis, which is a challenge. So there are different type of dentures like metal, plastic, full dentures or partial dentures. So all these dentures has to be removed from the mouth in a regular basis and cleaned thoroughly at least once a day to avoid any kind of fungal infections. So these dentures should be safely removed and washed and before you place it inside the mouth. So, how to remove a denture from the mouth? By flipping one side of the denture, it breaks the seal and helps to lift the denture and remove it out. The same can be done for the lower denture as well. The partial denture could be little tricky where you have to use a clasp to remove the denture. in the initial day of wearing the denture, just to avoid any dropping of the denture, you have to sit in one position during the removing and placing. You have to use regular brushes or the denture cleansing brushes to clean it, and you can use your liquid soap or the hand washes. Avoid using dental toothpaste. Once the denture is clean, store it in a denture box, and then while cleaning, you have to thoroughly wash with the running water. If the patient is a user of a fixer, then dry it with a tissue paper and use a fixer, and you can place it inside the mouth. If you are not wearing the denture, it is always advised to place it in a bowl of water or a denture box. When not in use, you have to cleanse the gums and other oral tissues properly. It is never advised to wear a removable prosthesis during the night, because that is the only time where the lining tissues of the mouth get some air or it recovers, because the whole day the denture is inside the mouth. So in order to avoid the previously said situation, the fixed options are the more preferred one and makes life easier. So the fixed options could be bridges or an implants. Coming to the bridges, let me show you one of my clinical case where the patient had come with a missing tooth, front tooth, and she wanted bridges, and we went ahead and prepared the tooth which can receive the bridges, and this is the final prosthesis the patient which we had finished within 2 to 3 days, and the patient happily attended her function. The bridges gives the instant solution, and it's been the proven technique for more than half a century. But the main problem is that we reduce the healthy natural tooth to receive the crown and to hold on the bridges. When the patient bites something in the missing area, the complete force goes to the teeth which holds on the bridges. So in due course, these supporting tooth might weaken. It might even cause shaking. So that is the reason why always the dentist takes an X-ray before he fabricates this bridges, in order to check whether the supporting teeth are healthy enough to receive such kind of bridges. So here is the most recent and the advanced procedure, the dental implants, where it's a permanent and a natural looking replacement that helps to preserve the jaw bone health, and it restores the aesthetics and functions. It almost behaves very close to the natural teeth. The dental implants acts as a separate unit which can receive and transfer forces to the bone, which preserves the bone and the neighboring teeth. So whether it is a single missing tooth or a completely missing teeth, you can always have an option of a fixed denture by using dental implants. Many of you might have a thought that I don't have a missing tooth. But what if I have a gaps or a chipped or a stained or a discolored tooth or a worn out tooth which is holding me back from socializing with people? The best solution for you is the dental veneers. These veneers are usually fabricated with the help of digital smile designing. So with the help of AI generated software, the complete smile is being designed. This is an incredible solution which enhances your smile, and it makes a complete makeover, and it enhances your appearance and self-esteem. It gives an instant cosmetic makeover. So these dental veneers are thin tooth colored shell that are attached to the front surface of the tooth to improve their appearance. It's something like your artificial nail stuck to the natural one. So based on the situation, the dentist will decide what kind of veneer will be best suiting to you. So you can transform your normal smile into an Hollywood one, which will boost up your confidence level. So now the most common question which we receive is that how to maintain a fixed prosthesis or the fixed denture. I would say that the bridges, crowns, and veneers are all almost maintenance free, because you have to follow the regular routine of brushing and flossing twice daily. If you're doing such cleaning process, that's more than enough, and avoid using any kind of toothpicks to those regions. It is always, in case if you're not familiar with flossing, you can always go for water flossing, where it cleanses every nook and corner of your teeth, mouth, and the dental implants. In case if you have a geriatric patient or an older people in your house, or if they have any kind of Parkinsonism, then they can always go for a water floss, which will make the cleaning process very easy. As we celebrate the achievement and resilience of women today, let's remember that the confidence begins with a smile. Whether you are a healthcare provider, a family member, or a friend, encourage the women around you to embrace the dental solution that can transform their lives. A missing tooth is not just a small issue. It has a dominant effect on the oral health, confidence, and overall quality of life. If you ever hesitated to smile because of dental imperfections, or if you know someone who have a missing tooth, don't ignore it. Seek professional dental advice and explore the right solution and treat them. Remember, your smile is the biggest asset you have and the precious jewel you have. So take care of it. Thank you for patience listening, and let's catch up for the QA session. Thank you again.
Yeah, thank you so much, ma'am. It was a really, really, helpful lecture in terms of the people, I guess, who are joined, very common issues addressed. So I don't feel like there are any questions, Mandana ma'am. So can we move towards the panel discussion part?
Yes, please. Yes, we can do that. Yeah.
Yeah, yeah. So let's move on to the group discussion, and then we can again have audience interaction for a little while. I would like to hand over the stage to Dr. Mandana ma'am for the same.
Yes. Thank you so much, Dr. Ketki, and thank you all for the marvelous presentations, and of course, Dr. Maya for the beginning uh, monitoring and the moderating. So it has been a very interesting session with very interesting discussions. Uh, what I would like is for each of you, I think, since there are no questions, okay, there's something from Dr. Bhuvan. Let's just take that and then we'll see. Okay, he has put a comment actually. Methyl paraben in toothpaste prevents bacterial growth, but concerns exist about its potential hormonal effects. While considered safe in low amounts, some prefer paraben free options. So, any add on comments to this?
Ma'am, it's the similar thing. Like triclosan also has antibacterial effect. So it just
Correct.
depends on a toothpaste. To what extent do we want these, or is just the mechanical cleansing enough? So how Apeksha ma'am said that probably adding fluoride to the toothpaste would be more beneficial than adding some antimicrobial part to it.
I also think it is important to remember what is done as routine. You know what any one of us might need for treatment, or rather, not even treatment, for maintenance, I should say, of our teeth, and what would be needed when someone is actually actively requiring an intervention. Someone who has a problem, then we are not just giving them a toothpaste just to clean, which is what I think
Correct.
would be required. So it's very important to remember the difference, because sometimes when we are doing a treatment, then the whole program changes, and the whole view changes, the reason changes. So it's always the same. It's just like you would not, on a everyday thing, we would not give anybody an antibiotic.
Yes.
Instead of washing hands, we will not tell them to use an antibiotic cream, let's say. So it's the same thing. On a daily basis, we are not going to ask anyone to use any toothpaste which is more medicated than is required, but sometimes it may be needed. And of course, that is my view without even being that much involved in the clinical practice of dentistry. Do the clinical dentists, the ones who actually do clinical dentistry of treating, want to add anything?
Yes, I'd like to add something to that.
Yeah, please.
We pay a lot of importance to what toothpaste we're using. Uh, I'm getting a lot of echo. 1 minute. 1 second. Uh,
We can hear you quite
but
clearly.
uh,
Yes.
But I think the bigger important part is the technique. Toothbrushing, how you're brushing your teeth, that's of prime concern. And what you require is a nice fluoridated foaming toothpaste. Right now, there's so many ads of, for sensitive teeth, for this thing, for that thing. But those are not really important. It's the technique which is of prime concern.
That is true. The technique is of course the most important part. That is true. Okay.
And we started with the charcoal powders, and we are finally moving towards charcoal containing toothpaste.
Yes, I know that's quite
Charcoal containing toothbrushes and charcoal containing toothpaste.
quite.
If I can say something, um, we are seeing a lot of products that are very specific to some kind of situations. And it is important because we dentists can prescribe it specific to this patient. So, general patients that are healthy can use some kind of toothpaste that's okay. But when we have a specific problem, then we can prescribe any specific toothpaste for this patient. This is important because we must know which one is better for each patient in this specific situation. That's what we are doing here. We are prescribing the toothpaste for the patients. I think that's important.
It's very well said. We are prescribing. So it is very important, I think, from the patient's and the audience's point of view. It's very important to remember when we talk about general use, something is very different than when your dentist is advising you to use something. So don't just decide that I'm not going to use this because, somewhere I have read that it may cause something. Your dentist knows what they're doing. It's just the same as you would trust your doctor. You need to also trust your dentist and know that they will do what is best for you. And things have specific indications at specific times that your dentist knows. Google will not know either. Yes. Anything else anyone wants to say?
I want to add to the question which was there for Dr. Apeksha
Yeah.
regarding the staining of the front teeth. I've seen very often, with regards to what Dr. Maya also said about using mouthwash. Chlorhexidine mouthwash also causes a lot of staining of the teeth. And lots of patients use it and don't come and tell us about it. They are using chlorhexidine at home. Apart from that, also a lot of not Ayurvedic medicines also have a lot of color, which causes staining. So maybe a detailed history to find out why the staining is also required for the patient.
Very true. And as a coffee drinker, I can tell you that that also makes a difference.
Yes, and also it makes changing in the taste, and that's very important because some women think that maybe it's from menopause, and then we must ask which toothpaste are you using or with which mouthwash are you using, and then we see they are using chlorhexidine mouthwashes. And this is not something that you must use regularly.
Yeah.
In fact, we don't need mouthwashes regularly. And so we can use it only in some specific cases with this dentist orientation. It's important to tell this.
Very, yes. As dentists, we prescribe chlorhexidine when there is an active infection. Is something that our audience should know is we prescribe it when there is an active infection. We will not ask someone, oh, we don't use it. Let's put it this way. I would not use chlorhexidine as a mouthwash on a regular basis.
And you can't have a mouthwash replacing brushing. You can't say today I'm not going to brush because I'll do a mouthwash in the night. I don't want to brush tonight. That doesn't work.
That doesn't work. I think it's only again in a case based where for some reason it is not possible to brush. Maybe, someone is in a hospital, hospitalized, or, situations like that. That's different. But that again, essentially we are just doing something that's better than nothing, but it is not the same. It still does
It
not
cannot
replace
replace
brushing.
it.
Yeah.
Uh, I like to compare with when you are washing the dishes. If you take a dish that is very dirty and you just put it in the water, it won't clean. You must brush
Yeah.
your
Yeah.
dish. So
Correct.
it's the same. If you just do a mouthwash, it won't work. You must brush it.
And
Correct.
Now I have a
apart
Good
from
one.
that,
question
also
about the electric
regular
toothbrushes.
changing your toothbrush. People use their toothbrush for 6 months, 1 year. So
True.
this is also an important part to be educated that you need to change your toothbrush. I recommend after every 8 weeks is what a soft toothbrush.
Yeah. And it really depends on the kind of pressure you use, because, like, my husband goes through toothbrushes at a phenomenal rate.
So this is a nice guideline.
I'd like to add to
If
that.
your toothbrush frays within 8 weeks, that means you're applying too much pressure. And if your toothbrush looks absolutely normal after like a fresh toothbrush in 8 weeks, then you're probably not brushing enough.
Good point. Yes. Yes, Dr. Apeksha.
I'd like Yeah, I'd like to add to that. Where children are concerned, they're constantly getting, infections. They have coughs, colds. So it is a policy to discard the toothbrushes after every cold. All right. However, you can use ultrasonic cleaners so that we are not increasing our plastic waste also.
Yeah.
Not ultrasonic, sorry, ultraviolet cleaners. There are
Mm.
ultraviolet cleaners that are available
Mm.
very easily. They are even available over here on First Cry. And you can just clean your toothbrush, put it under the ultraviolet light, clean your toothbrush, and reuse it.
Yeah, I think for babies, brushes, that would make sense because they will not really be frayed.
No, they won't be.
They won't be frayed. Yeah, it's just because the child had an infection. Yeah, that's a good one
Yes.
actually. And
And I
post
keep
COVID, I think
getting
there are lots
questions.
of ultraviolet sterilizers or whatever disinfectants and all around the place.
And what about electric toothbrushes? Because I keep getting questions on that. What do you advise? Will you advise? For normal girls, normal boys. The parents ask
Yeah,
questions on
the
that.
most important thing, the most important thing is to know how to see. We are still not in the generation where the mouth is getting mapped by the toothbrush, and then the toothbrush is going around and doing the cleaning. You still have to move your hand, even if you are using a battery operated brush. You have to move your hand and clean the entire mouth. You have to know how many teeth are there in your mouth, and you have to put it on the top of your teeth and on the side of your teeth and on the inside of your teeth. So I prefer in the beginning that the children are learning to brush manually. After that, they can use sonic brushes.
I think that it's
Very
only
good.
for bedridden patients and handicapped people, something like that. It's not for
No, no.
people who have.
I
You
use,
use it, huh?
and I love the timer.
So
You
electrical
actually know when your 2 minutes are up.
Uh,
electrical toothbrush
It is
also
so
have
important.
only elliptical or circular motion. Okay, and what we really require to clean our teeth is a sweeping motion. It's like cleaning a room with a room with a broom, not just like a round elliptical thing. So it doesn't really reach the area where we want to clean, that is between the gums and the teeth. You're not able to reach that. So it's great for people who have some kind of physical deformity and are unable to brush. But for regular people, I would recommend a normal toothbrush, toothpaste, and that's
yes,
it.
That
yes.
much as even though I said I'm using it, it's not necessary that I'm trying to be an example to everybody else. Not every dentist has the best of teeth, me included. So, so I would not suggest you necessarily follow my example. I love the electric toothbrush for two things. One is the timer, and the other thing is the small head. I used to always find the other toothbrushes, the head too big to reach everywhere. With this, I can, and since I have a severe gag reflex, with this, I can go everywhere quite happily, and I'm quite satisfied at the end with the result. But then again,
Today
not
we have
necessary to
today,
follow my example. Sorry, Dr.
but
Lachesha.
sorry, we have good devices today. Nowadays, we have good electric toothbrushes that can be very helpful, and we have some papers that show that this kind of electric devices can be very useful compared to regular toothbrushes. So I think depending of the case, it's very good to stimulate to make the movements, and in some patients that cannot do it regularly and are not able to achieve this kind of cleaning. Sometimes with the electric devices they get better. So it's important to individualize, I think, always.
Also,
I have
maybe
a
And about
finally,
desensitizing
depending
toothpaste
on,
also.
sorry, what?
About the desensitizing toothpaste, and
Huh?
the patients, if you prescribe once, they keep using it forever.
Yeah.
question for Dr. Supriya.
Yeah, go ahead.
Dr. Supriya, what is your take on brush biopsy?
Ma'am, it is a good technique. There is no doubt about it. Because it has that brush, so it actually gets you more sample size. But earlier, it used to be sent to a particular company or to a particular country, and then they would report it back. You needn't do that. It can be given to your local pathologist or in your labs or in colleges, and it can be assessed. So generally, a ice cream stick is used when we are using those proliferative cases. A brush biopsy would be a slightly more invasive, but you would get more material in that.
So could you just tell the viewers about how the brush biopsy works? Because lots of patients are really scared when you say biopsy, they are terrified.
Yes.
And as a screening device, biopsy does not work. Can you just help us and tell us more about that?
Yes. So actually, a brush biopsy, though the word says biopsy, it is basically a type of cytology. That means collection of the superficial cells itself. Only we use a particular brush in that. So now, suppose you have an ulcer or a suspicious lesion. So how are we going to get the cells which are at the top, which could give us a picture or an idea of what pathology is happening underneath? So sometimes we use a swab. Sometimes we use these pores. Ice cream sticks are used in some of the institutes, or we can use a brush. So when the brush biopsy actually came into picture, those cells were stained and the photographs were actually sent to the pathologist, and then they would be giving you a report on that. So when we use a brush biopsy, we have more chances of getting the cells, that is the cells which are depicting the underlying pathology. So brush biopsy is basically that. Then there is something known as liquid biopsy also, wherein again the cells are collected, but like in a pap smear, they are centrifuged, they are spinned at a very high rate, and the cells are collected, and those cells are smeared on the slide. So when we are suggesting any patient any investigative technique that is going to add to our existing knowledge or confirm that whatever we have diagnosed is correct. So then there are various ways. So instead of going to a direct biopsy where you're taking a tissue, you can use these cytology, exfoliative cytology techniques. So brush biopsy, liquid biopsy, or oral cytology are almost essentially same. Only the technique that is used to get the cells is different. So it's nothing to be scared of. It is not an invasive technique. There's going to be no injection, no removal of the tissue, a wound created, nothing. It is just the overlying cells are swept up and then they are analyzed. So the technique is slightly different than the conventional cytology. And so there is this brush biopsy and liquid biopsy.
Thank you, Dr. Supriya.
I
Yes.
had a question for Dr. Sunanta.
Yes, ma'am.
Please.
Ma'am, Yeah, ma'am, I wanted to know, you suggested, water flossing. However,
Yes.
there are a lot of patients who are wanting to use a water floss where there are tight contacts. And they tell us that, our dentist has told us to use water floss. So what would you suggest? Oh, regular flossing or water flossing?
Actually, if they're comfortable with the regular flossing, yes, yeah, they can go ahead with the regular flossing. Again, regular, if there is a tight contact, again, patient will find difficult, and they go up to the gingiva or the gums, and the gums bleeds. So that's why if they're not very sure about how to floss, then we advise the patient to go for a water floss. And in many cases where there is gingival precision, and in cases where the implants, multiple implants are placed, we go for a water floss. Tight contact, whether it is a floss or water floss, yes, the patient do complain. But I think if there is a tight contact, there won't be any kind of food accumulation. So there's no need of flossing there, just brushing will do. And as the with the theme of the thing, I would like to add up that as a prosthodontist, we give a special radiation stent if the patient is undergoing radiation therapy, which most of them are not aware of. So, if a patient is undergoing radiation therapy, yes, we have so many kind of stents for the tissues, for the tongue, for the teeth, to avoid any kind of deterioration to those live tissues. So, we give multiple stents. So, please ask your dentist and get the stents done. And we do also rehabilitate post-operatively if a patient is lost any of the jaws like maxilla or mandible. We, as a prosthodontist, we completely restore their facial form, aesthetics, and in many cases during the COVID mucormycosis cases, we have restored the maxilla, even the ocular prosthesis we have given. So, just for the information for the audience, we, as a dentist, we don't only replace a teeth, we do replace all the maxillofacial structures.
Yes, I think it's very important for the audience to remember that um, today what we do is oral and maxillofacial. It's no longer just oral. It's no longer
Or,
just the mouth and just the teeth. It is literally, if I had to tell you this much, and the part of the neck, of course, it is both the upper and the lower jaw and everything in between is entirely our territory, stopping at the throat and the nose and the ears. That's of course the ENT side, but everything else in between is our area. And we have very well established specialities that take care of literally anything that can happen in those parts. Probably not as well known. And I know people still get a toothache and for some reason go to their family doctor instead of a dentist. But really, dentistry is now way ahead. You just need to stay in touch with us. That's all.
Dr.
Sometimes we have
Madan.
patients who come to us with medical problems also. It,
That,
Yes,
that's also good.
yeah.
I'd
Like
like
I have a
to.
fever, what do I do? Dr.
Well,
Lal, I have one question
I'd
to
like
ask
to
you.
add to Dr.
Um, uh, when they do flaps for patients from a skin flap in the mouth, and there's always hair growing over there.
hair inside, yes.
How, even if you do laser, after some time again the hair does come back. How do you manage that?
Yes. Actually, we require those hair follicles, ma'am, because that gives an additional retention for whatever prosthesis we give. Yes, laser might help in removing the hair follicles, but the irregularity, yes, we need those irregularities sometimes to retain the prosthesis.
I do know that in the last institute where I was and where they used to do this work quite regularly, they used to literally ask the patients to they have to literally shave that part.
Shave.
Yes.
Yes,
So
correct.
Currently, the laser is doing some help.
Yeah.
So laser is really helpful when the hair is black in color. But for older people, when the hair is not black, the laser doesn't really work when it's already white.
Okay.
Oh,
That's
that's a
interesting.
news. Yeah.
Yeah,
Yeah.
that's interesting.
Okay.
Dr. Letitia, you were going to say something?
I would say to adding to Dr. Sananta that it's very important the information she gave because people don't know that is the dentist, the prosthetic dentist that replaces, for example, the nose, the ear,
Yes.
the
Yes.
eye
Yeah.
when the patient lose it from the treatment of cancer. So it's a wonderful and very beautiful work that dentists do, and they don't know that is the dentist that make the ear, the
Yeah.
ear,
I.
eye, the
Yes.
nose, and it's so beautiful because this is a different kind of static treatment, and it's so wonderful because just puts the person again in life in social convivation. So it's a wonderful work that the dentists do, the
Yes. I would like to
prosthetic
add on. Yeah.
dentists.
With the advent of CAD-CAM, we also have a patient-specific implant where if the patient doesn't have a jawbone, we give a complete replacement of it. Previously, the bone from the femur, fibula, or iliac bones will be replaced, where the patient needs two surgeries. Currently, with the invent of CAD-CAM, we have a patient-specific implant where we design the implant beforehand or before the surgery, and then during the time of surgery we cut open, remove the affected part and replace it with the titanium patient specific implant. And maybe within a month, once the patient is out of the ward, we can immediately give them an prosthesis, sometimes even a fixed prosthesis, and that is a
Oh,
life changer for them.
it would be. Probably difficult for us to even imagine, but definitely it would be.
Yeah,
Yeah.
we had faced so many patients during COVID, mucar patients.
Mm. Yes, mucormycosis did some amount of considerable amount of damage, I must say. Yes. So, okay, let's do a quick wrap up. I know each of you tried to keep your talk short. So, was there something specific you wanted to say that you couldn't include in your talk and now you can just say it in one sentence? Let's start with in the same order you present it. We'll go with Dr. Apeksha.
The most important thing I think from my talk would be that they start brushing and start cleaning their child's mouth really early. Uh, Most of the times when they come into the clinic, I ask them when was the first tooth, when did the first tooth erupt, and when did you start brushing? And there is a lag of about 2 years in that sometimes, when the first tooth erupted and when they started brushing. So that is something that I want the parents to really understand and make sure that brushing is starting when the teeth erupt.
True. Yes. And who was next in the presentation? Sonal, Dr.
Yeah.
Sonal, yeah.
In one sentence, I would say the most important thing is to maintain impeccable oral hygiene, regular visits to the dentist, and that's the key to all your problems.
True.
That's it.
Yes. Dr. Supriya?
I totally second Dr. Sonal that regular visits and maintaining good hygiene is important. And I would say that as we are educated, we come into contact with so many ladies who probably do not have access to the knowledge or to these kind of webinars or to anything which says or which tells them that tobacco usage in any form is not good for your health. Even mishery, or sometimes they use it just to
just so that they don't become hungry, or it has become a habit, or for bowel movement, for whatever reason, or even for morning sickness, do not resort to any form of tobacco. It is not going to be solving your problem. So I think we need to, as in each woman, need to actually empower other ladies also, that tobacco in any form should be a big no.
Mm, true, very true. Yes. So, Dr. Leticia,
Um, I'd, I'd like to tell that dentist is very important before, during, and after cancer treatment. And this is not about oral cancer. Any
yeah,
kind of cancer in anywhere, in any treatment should bring some oral complications. So please ask for help and ask your dentist how to help you to manage these complications, because this is so important to you to go through the cancer treatment. It can be lighter i- if you take this kind of care. And oral hygiene is so important during cancer treatment. And uh, I think this is unanimous here. We all talk about oral hygiene, and so this is very important. And please count on your dentist during cancer treatment. It's very important.
yes. Dr. Sunanta,
Yes. First of all, I would like to tell the audience, please don't Google all the treatments, and please visit your nearest dentist and get their opinion and go ahead with the treatment. Whether you're 18 or 80, your teeth is very important and maintain it well. So that's my suggestion. So don't Google it and come up with the treatment. Patient comes to us and tells the treatment. So that's the most what I should say embarrassing, or I would say even pathetic criteria today.
yes, it's very difficult. And I think the one thing that we dentists have, and if you watch our, our feeds on Instagram or anywhere, it will periodically come up with someone saying, telling people, only take care of the teeth you want to keep. So it's the same. You just have to take care of the teeth you want to keep. If you want to keep them, you got to take care of them. There is no shortcut. With only one addition there, that it's not just the teeth, also the rest of the tissues in your mouth need care. Because remember, the mouth is highly abused. Besides the fact that it has the highest number of bacteria and microbes naturally there, some good, some bad, but it is also, think of all the things we put in our mouth. If you put that kind of hot coffee or tea on your skin, you would burn. And yet we very often do it to our mouth, which has actually got a thinner lining than our skin. We have very, very hot tea and follow it up with very, very cold water. We have very hard food. Sometimes we have very sticky food. We have all kinds of things. And it really requires care. Just be caring and loving to your mouth. That's all I can say. As a dentist, I think be loving to your mouth. I can't think of anything else. Dr. Maya, I think I'm going to let you wrap up. The last comment, Dr. Ketki has logged out. I mean, is lost, I think, connectivity wise. So I will let you wrap up.
I will wrap up. Huh?
Yes.
Yeah, thank you, Dr. Mandana. It was a very informative session. I was really scared how I will be here, because I'm not that comfortable in online sessions, and you made it very comfortable for me, and very nice meeting you all, young and very energetic speakers. And it was really wonderful hearing all of you, and wonderful to be part of this oral pathology 360 as an oral pathologist and as a woman in leadership. Thank you very much, Dr. Mandana. Thank you all.
I'd like to say thank you all. Thanks to all of you for this absolutely fantastic session. amazing presentations. It was way beyond even what I could imagine. I just had an idea that we should talk about things from childhood to through life. But I mean, I could only think. It was just a thought. You all have literally brought it to life. And that is absolutely amazing, the way you have done it, the way you have presented it. I will cut up this and make it into shorter videos also and share it on the channel so it's easier for people to watch smaller bits. But it was great. Thank you. I should also thank again Popma and the Peer for Child Academy for being a part of this, supporting us right throughout. And really, and of course, our audience, whether you're watching it now, and I know many will be watching it tomorrow, thank you for being with us. This was our first real foray into public education and public awareness. We are normally just training other professionals, we keep talking between ourselves, but we thought it needs to reach you. And thank you for joining us. Thank you for being here. If you liked it, hit like and also share it with someone else who you think may need it. Keep watching our videos. We will be having more videos on this channel. We will bring back all these lovely speakers for individual one on ones for you. And yeah, with that, I think we can just say thank you.
Thank you very
Thank
much.
you.
Bye bye.
Thank
Thank
you.
you. Thank you,
Bye
ma'am.
bye.
Bye.
Bye,
Bye.
everyone.
Thank you.
Bye.
Bye.
Thank you so much. Thank you.
Happy Women's Day to
Everyone.
everyone.
Yeah.
Oh,
Happy Women's
happy
Day.
Women's Day. We forgot to wish everyone. Happy Women's Day.
Yes.
Yes. Happy Women's Day.
Happy,
Yes. Thank
happy
you.
women.
Bye.